More than half of the most popular mental health videos on TikTok right now contain misinformation. That means millions of people are scrolling, watching, and absorbing advice that's either oversimplified, misleading, or flat out wrong. Hi, I'm Dr. Marie Donna, youth and adult psychiatrist, here to discuss all things mental health and wellness related. I'm here today to try to help people make sense of mental health without all of the extra social media noise. And I get it. Mental health content online can be so relatable. It feels like someone finally understands what you're going through. But sometimes that viral clip is leaving out the most important part of the story. So today we're breaking down the most common myths I see on social media, and I'll explain what's wrong with them, and most importantly, I'll give you the real evidence-based facts. Stick around until the end because I'm going to show you a quick 30-second trick to fact-check any mental health video you see. First, let's talk about why misinformation is everywhere. Reason number 1, social media rewards short, snappy content. But mental health isn't something you can just explain in 10 seconds. We're talking about complex conditions that involve biology, environment, psychology, and not a quick hack. Number 2, personal stories feel powerful. Someone shares their journey and it resonates with you. Maybe you felt exactly the same way. But one person's experience doesn't always match the science or what's right for you. And number 3, the algorithms. They don't care if something is accurate, they care if it gets engagement. Dramatic or shocking claims spread faster than a nuanced explanation. Now, to be fair, there is amazing mental health content out there. I follow creators who are doing incredible work, but the problem is it can be really hard to tell the difference between what is right and what to look for specifically. And that's why I'm doing this. Now let's bust some myths. Myth number 1, if you're sad for 2 weeks, you definitely have depression. Okay, this one is tricky because part of it is rooted in the actual diagnostic criteria of major depressive disorder, 2 weeks of symptoms. And yes, one of the symptoms we look for in major depressive disorder is low mood for at least 2 weeks. But here's the thing, sadness is a normal human emotion. You can be sad for 2 weeks after a breakup, a loss, or just having a rough patch in life without having a depressive disorder. Depression is about more than just time. It's also about severity, impact on functioning, and a cluster of other symptoms like changes in sleep, appetite, concentration, and thoughts about self-worth. So if you've been sad for a while, it doesn't automatically mean you have depression, but it's still worth talking to a mental health professional about if it's interfering with your life. Myth number 2, ADHD is just being lazy or distracted. This one gets me a little fired up. ADHD is not laziness. It's a neurodevelopmental condition that impacts executive function. That's your brain's ability to organize, prioritize, and regulate attention and motivation. I've had patients who can hyper-focus for hours on something they love, but they struggle to start even simple tasks that feel overwhelming. That's not a character flaw, it's how their brain processes information and rewards signals. Calling ADHD laziness just adds shame and stigma on top of something that's already hard to manage. I hear it all the time, to complete a task that might be simple to other people who don't have ADHD. Myth number 3, you can self-diagnose and treat with supplements alone. Supplements can play a role in wellness, sure, but they are not a replacement for a thorough evaluation and real treatment plan. I've seen people spend years trying different powders, gummies, tinctures, etc. Meanwhile, the underlying condition, whether it's anxiety, depression, ADHD, or something else, goes untreated. And some supplements can even interact with medications or worsen symptoms, and I've seen this too. If you want to try supplements, great. Just do it alongside guidance from someone who knows your full picture. Myth number 4, if therapy doesn't work right away, it's not for you. Oh, I wish therapy worked instantly. Life would be so much easier. But therapy is a process. It takes time to build trust with your therapist, to identify patterns, and to practice new skills. Sometimes the first therapist you meet isn't the right fit, and that's okay. It's a relationship, and relationships take time and adjustment. If you quit after just 1 or 2 sessions because you didn't see a big change yet, you might be walking away right before the real progress starts. I will also say too, I know I mentioned checking for other therapists, but therapy is all about rapport, ability to communicate and trust someone. So if you find a therapist and you don't really getting along, it's okay to explore other therapy options as well too, until you find someone that actually fits and works with you. how this can be impactful in the real world of bad information. I've seen firsthand how misinformation often can delay the right diagnosis. One patient came to me convinced they had bipolar disorder because of a checklist they saw on TikTok. But after a thorough evaluation, we realized their symptoms were actually just related to unresolved trauma and anxiety. If they had continued down the path of self-diagnosis, they might have ended up on medications that weren't appropriate, or worse, avoided care altogether because they thought they already knew what was wrong. Social media can connect us, educate us, and even inspire us to get help, but it should never replace a full evaluation with a qualified professional. And I've also seen the alternative too, where someone thought that they had bipolar, told a provider who did not have a full medical degree, was put on bipolar medication, and it really detrimentally affected their life. But after seeing me, we did a thorough evaluation, found that they didn't have bipolar disorder, took them off their medicine, and they're doing much better. So how can you fact check any mental health video in 30 seconds? Here's my quick 30-second fact check method. Ask yourself these 3 questions. Who is giving the advice? Do they have the credentials or lived experience to speak on this? And if they have credentials, are they actually relevant? I am a psychiatrist, a board-certified, double board-certified child, adolescent, adult psychiatrist, obesity medicine, perinatal, all of the above, and I had to go to medical school for this. Sometimes people have degrees, but you have to make sure they're actually relevant to what you're treating. Number 2, where is the evidence? Are they citing research, or is it just, trust me, it worked for me? They should have research or scientific-based evidence to back up what they're saying. Number 3, what's the intention? Are they genuinely trying to help, or are they selling something, chasing views, using fear to get clicks? If any of these answers feel shaky, that's your red flag. Save the video if you want to discuss it with a provider, but don't take it as absolute truth. Mental health is too important to leave to algorithms. If you've seen a mental health video you're not sure about, drop it in the comments or tag me. I might review it in a future video. If you found this video helpful, hit like, subscribe, and share it with someone who spent a little too much time scrolling on TikTok. Your share could protect someone's mental health and maybe even save a life. I'm Dr. Donna. Thank you for watching. Take care of yourself, and I'll see you next time.